Hey future doctors, welcome to Pocket MBBS where medicine fits in your pockets. Now let's study today's topic, that is female genital tract. In which we see the different precancerous cervical changes and the systems. Now first understand the normal anatomy of a female, in which the normal genital tract of a female consists of uterus, cervix, vagina, fallopian tubes and ovary. Uterus is divided into four parts, that is fundus, body, isthmus and cervix, and has three linings: endometrium, myometrium, perimetrium, and is endometrial cavity. Lining of the uterus are endometrium, myometrium, perimetrium, and parts of the uterus are fundus, the uppermost part, body where implantation occurs, isthmus between body and cervix, the lowest part opens into the vagina. Then cervical precancerous stages is a spectrum of intraepithelial changes that begins from minimal atypia and progresses through more marked stages of intraepithelial abnormalities to invasive squamous cell carcinoma, which occurs in the females more than 40 years of age. Means first there is atypical changes occurs, then lead to cancer. Then etiology of human papilloma virus is HPV and environmental factors. These are the causes for cancer in female. Human papilloma virus is the most common risk factor of cancer in females, and it is squamous cell carcinoma. Human papilloma virus is associated with CIN and cervix cancer. It is a sexually transmitted DNA virus. Risk factors associated with increased exposure to human papilloma virus are multiple sexual partners, first intercourse at young age, high parity means giving birth to more number of children, a male partner having multiple previous or current sexual partners, and inefficient immune response. All these leads to human papilloma virus infection. Then human papilloma virus classification are high risk human papilloma virus and low risk. High risk is malignant and low risk is benign. High risk has 6 subtypes, includes 16, 18, 31, 33, 45, 52, 56, 58, 59 and 68. Low risk includes 6 and 11 subtypes. High risk is a cause of squamous cell carcinoma of vagina, vulva, penis and anus. In male, it occurs because of sexual transmission. Low risk causes genital warts. Now we will see the oncogenesis of HPV virus, that is a normal cell in which the HPV virus infects. Then it reacts with the human host genome, where E6 and E7 are the proteins secreted by human papilloma virus that mix with the host genome, and E6 cause P53 gene degradation that leads to blockage of tumor suppression gene, which leads to outgrowth of the cells. And E7 and genome leads to inhibition of RB gene that leads to dysregulation of cell proliferation. In uncontrolled cell growth, cell cycle activation occurs and malignant transformation of cells is seen. Now we will see the human papilloma virus proteins, that is E6 and E7. E6 cause P53 inhibition and E7 cause RB gene inhibition that leads to increased cell proliferation and genomic instability. Now the environmental factors that leads to carcinogens in females are presence of co-carcinogen, that is cigarette smoking, that contain polycycline hydrocarbons. Then coexisting microbial infections that also leads to cancer, dietary deficiencies, hormonal changes and use of oral contraceptive pills. Now the classification of cervical precancerous are carcinoma in situ system, cervical intraepithelial neoplasia and Bethesda system that is presently used, which includes squamous intraepithelial lesions. Why it is preferred? Because in first and second condition it is called carcinoma or neoplasia, but it is a precancerous stage, so it is preferred to say lesions. That's why Bethesda system is preferred. Now CIS system is classified the carcinoma into three types: mild, moderate and severe dysplasia. CIN classified into CIN I, CIN II and CIN III, and Bethesda system classified into LCIL and HCIL, L for low, H for high. Then we will see carcinoma in situ system. It is based on the dysplasia, means bad molding, which is commonly used atypical cytological changes in layers of squamous epithelium. Means when in squamous epithelium atypical changes is seen, it is called dysplasia, and it is the basis of carcinoma in situ system classification. It is a pre-malignant lesion. The cervical intraepithelial neoplasia system is also present. Dysplasia lesions features are loss of basal polarity, increased nucleus cytoplasmic ratio, normal is 1:4 to 1:6, increased number of mitosis, hyperchromatism of the nucleus, pleomorphism, and basement membrane insect, so no stromal invasion is seen, which is present in carcinomas. Now we will comparatively study both systems, CIN and CIS system, in which CIN I and mild dysplasia means the features are less than 1/3 of the thickness of epithelium is involved with carcinoatypical cells. In CIN II, we will see moderate dysplasia means 1/3 to 2/3 epithelium is involved with atypical cells, and in CIN III, we will see severe dysplasia seen, or more than 2/3 in epithelium is involved with atypical cells. Now, rate of progression. Now we will see the rate of progression of CIN system into the cancer. First, it regresses to normal. Chances of converting back into the normal is 60% in CIN I, 40% in CIN II, and 30% in CIN III. If persistent, it remains is the same. In chances is 30% in CIN I, 35% in CIN II, and 50% in CIN III. And it progresses to, and its progression occurs that in CIN I chances is 10%, CIN II is 20%, and CIN III we don't know. And progression to cancer chances is CIN I is 1%, less than 1%, and 5% in CIN II, and CIN III 20% chance. So the best prognosis is seen in CIN I and poor prognosis is seen in CIN II. Now we will see the image wise of the three classifications. It is normal epithelium, in which we see mild dysplasia, or CIN I, in which 1/3 part is involved, less than 1/3 part is involved, and in moderate 1/3 to 2/3 part is involved with atypical cells, moderate dysplasia with CIN II, and more than 2/3 part is involved. Now we will see the presently used system, that is Bethesda system or SIL system, Squamous Intraepithelial Lesion system, in which the carcinoma is divided into two parts, low SIL and high SIL. Low SIL is correspond to CIN I, and high SIL is correspond to CIN II and CIN III, which includes mild dysplasia and includes moderate to severe dysplasia. It is related to HPV 6 and 11 infection. It is related to 16 and 18 infection. It has 10% progression to high SIL and 10% progression to invasive carcinoma within 2 years. Means it has very low chances of conversion to high SIL, H for high and L for low. Now we will see the diagram wise H-SIL and L-SIL, in which we see the normal cells of cervix, intermediate cells and normal superficial cells is present. This is a normal condition. But in low SIL, pleomorphic nuclei is seen, means variation in shape and size of the nucleus. Now in H-SIL, we will see altered NC ratio, means the nucleus size is more than cytoplasmic size. Then moderate nuclear dyskeratosis is also seen, and abnormal round parabasal body is seen in the diagram. And it is a figure of exfoliative cytological changes that seen in the cervix. Now that's all for today's videos. Follow for more such videos and do like, share and subscribe my content. Thank you.